Hi, good people. Yesterday, I received a lot of calls from patients stranded in various hospitals. I decided to go to those hospitals and just get to know what's going on. So I went to 3 hospitals, 1 level 6 hospital, private, 1 level 4 hospital, public, and 1 level 5 hospital, public. I found a lot of patients in the queues, and I got to understand what was going on. This is what patients told me. They told me wale ambao wanataka services za radiotherapy, chemotherapy na dialysis, most of them wanaitishwa pesa in advance by hospitals. So lazima ulipe kwanza ndio upate hiyo huduma. So I asked the administrators of those hospitals, why are they asking for money in advance? And they told me that they are owed so much money by NHIF. Some of them, one hospital told me that they are owed 233 million shillings. And therefore, they are very afraid because NHIF is closing down, SHA is taking over, but there's no commitment that SHA is going to pay pending bills that were incurred by NHIF. So the administrators of the hospital are worried that they must start giving services under SHA and they don't have any assurance that they are going to be paid their pending bills. The other issue was, hii system ya SHA ni kama inaanguka sana. Yani, kuna hospitali nilienda nikapata kulikuwa na wagonjwa wa 6 ambao walikuwa kwa line tangu asubuhi 6 am. Na walikuwa wanagojea system ya SHA iamke ili wapate kitu wanaita approval. Ndio wapatiane services on approval that they will be paid by SHA. Lakini system inaanguka, na ikianguka it is not effective. It is not smoothly responding. So hizo delays ndizo zinafanya wagonjwa wengine watete, complain ya kwamba kuna delays na hospitali hazitaki kuwapatia matibabu. Ya mwisho, nilienda kwa hospitali moja nikapata wagonjwa wako kwa line, wanaambiwa kwanza waingie katika mtandao wa SHA ili wapate message ya kwamba they are in the system. Sasa wagonjwa wengi wanaingia, wanatumiwa message, wanaambiwa kwanza walipe 3,957. Sasa walikuwa wananiuliza tunalipishwa hii pesa ya nini? Kwa sababu tayari ile system ya NHIF walikuwa updated. Sasa kwa nini wanaitishwa pesa on top? Sasa huyu ni mgonjwa ambaye ako kwa line, anataka urgent dialysis. Akifika hospitali anaambiwa kwanza ingia kwa system imekwama, na wakati inapoamuka inakuitisha pesa 3,000. Utatoa wapi? So that is the mess that is happening right now in our hospitals. Now, as a leader, as a member of parliament, it is my duty to advocate for the rights of my people. And therefore, I want to put it in record that I am not satisfied with the services being rendered in hospitals, not because the hospitals have a problem, but the NHIF and transition from NHIF to SHA has a problem. We cannot spend over. Yes, those of you who've been following me on my medical fact-finding mission in hospitals, I am sure you have now known where the problem is. I have explained to you what I discovered and I got from the patients, from the hospital admins, and I have concluded that the new SHA services provision is erroneous. I have a problem. I have a problem with the assumption that we can do a trial and error program on the lives of people in Kenya. I have a problem with trying to migrate people from NHIF to the new SHA program without doing sufficient public sensitization, without doing a pilot project and getting to know what are the chances of success, and the assumption that it is all right for hospitals to lose money that they were owed by NHIF and they will survive and move on. I have a problem with those 3 issues. And I have a very big problem on matters to do with using taxpayers' money in procuring the new SHA system that we were told that we have spent over 100 billion to procure a system that is going to manage the SHA medical services provision. I told you I went into one hospital and I found patient waiting for over 7 hours because the system was down. So do you think we are right to procure this system at that kind of lump sum money, yet the service is dropping every hour? Yes, we know new systems get some teething problems. But don't you think it is sensitive for us to try a new system on a real life situation where we are risking to affect people's livelihood and chances of living? I mean, to me, trial and error with our patients is a no-go zone. I will not smile with anybody to say that this system is okay. No. I will say it as it is. SHA is a good proposal and has been a very good proposal. But for us to agree and deliberate that we can now implement it on the lives of Kenyans, we needed to do a serious pilot. And by the way, the whole package is coming with an element called UHC, Universal Health Care. If my memory serves me right, UHC failed in 2 counties. The last regime, or the previous regime, tried a pilot project of UHC implementation in 2 counties, I guess, and one was Nyeri. And what were the results? It failed mercilessly. So if it is already failed in a county's pilot, why are we pushing it down the throat? If it failed on a 1 county pilot trial, what assurances do we have that it is going now to succeed in 47 counties? Come on, guys. I think something is completely wrong. I doubt if we are going to succeed in this project. You know why? Because even the speed that we took to pass these laws in the National Assembly was suspicious already. We were never given an opportunity to learn and study and get to know what's going on. These questions came, and within 2 hours, we had passed the bills into